What if I told you there's a drug we give in hospitals that literally stops your heart? Sounds wild, right? It's called adenosine, and it's one of the coolest and freakiest drugs we use in emergency medicine. When someone's heart is beating way too fast, like 180 beats per minute or more, and it's coming from the upper chambers of the heart, we call it supraventricular tachycardia, or SVT. To fix it, we use adenosine. It's like hitting the reset button on the heart's electrical system. Adenosine works by temporarily blocking the AV node. That's the gateway that electricity uses to get from the top of the heart to the bottom. When you block the AV node, your heart stops beating. Yes, you heard correctly. The heart actually flatlines for several seconds. That's normal. In fact, that's why we're giving it. We basically force shut off the heart and hope it starts up again in a normal rhythm. If not, we have to use something called electrical cardioversion, where we use electricity to momentarily stop the heart, although this and adenosine are typically methods of last resort. We give it as a fast IV push, administered as fast as humanly possible. If you push it too slowly, it will have no effect. The half-life of adenosine is about 10 seconds, meaning if you don't push it lightning fast, absolutely nothing happens. To the person receiving it, it can feel extremely intense, like a sudden tight chest, breathlessness, and a sense of doom. It literally is the sensation of dying, but it only lasts a few seconds. We always warn patients ahead of time. This is going to feel weird. You might feel like you're dying, but you're going to be just fine. What happens if your heart doesn't restart after the adenosine wears off? Well, that's why we keep the pads attached to the patient with several team members on standby to begin emergency resuscitation, although it's exceedingly rare for such measures to be required as the heart restarts on its own in over 99% of cases. So yeah, adenosine stops your heart to save your life. It's one of the coolest things in emergency medicine. I've gotten the opportunity to administer this, and I can tell you that it's extremely unnerving the first time.